So ADHD, probably one of the most talked about mental health diagnoses on social media. Because of all the information out there, some of it useful, some of it definitely not very useful. A lot of my patients have questions about this diagnosis. They're considering, do I have ADHD? And if so, what does that exactly mean for me? And once in a while, I like to give a book recommendation to some of my patients who enjoy reading or listening to audiobooks to help them gain a much fuller understanding of a diagnosis and what it means for them. So today, I would like to talk to you guys about the book I often recommend to my patients with ADHD. I'll talk about why it is that I recommend it, some of the things that my patients find most useful, most helpful from that book, and how it also changed my own understanding of ADHD and how I approach it clinically. And at the end, I'll also discuss some of the points I don't agree with in that book. And for those of you new to the channel, welcome. I'm Dr. Robert, a board-certified psychiatrist. And on this channel, I enjoy making educational videos on various mental health topics. If you like today's video, my prior videos, definitely like and subscribe, it really helps out. And let's go ahead and get started. Okay, so what is this book I'm talking about? Well, it's this, Scattered Minds by Gabor Maté. I think I'm pronouncing it correctly, Gabor Maté. So a quick info on the author, Dr. Maté. He's a physician in Canada. I think he still practices, I'm not fully sure on that, but he does write a lot. He has many books written about addiction, of course, ADHD, and kind of his main premise in many of his books is the role of trauma and environmental factors and how we develop as adults and how early life experiences affect us later in life. And in the book, he also discloses that he himself has ADHD. It took many years, a very long time for him to be diagnosed, long after he graduated medical school. But after gaining that diagnosis, it gave him a fuller understanding of himself. And one of the main premises of the book that I really like and I think that resonates with my patients is he doesn't describe ADHD as this straightforward diagnosis, something you're born with, and it's a chemical imbalance that you have to just fix with medication, and it only affects your focus, attention, and ability to perform at school and work. Because ADHD is so much more than that. He frames ADHD as a neurodevelopmental disorder. So basically a condition that affects the brain, of course, like any other mental health condition, and our environment as we grow up, as our brains are being shaped, influences the degree to which we exhibit these symptoms later in life that we've put under the umbrella of ADHD. That isn't just focus, fidgetiness, it's also our emotional regulation, our self-esteem, motivation, this ingrained sort of internal restlessness, a struggle to manage time, but also an ability to be more spontaneous, more creative, and having some advantages as well. So I came across this book during the first half of my third year of psychiatry residency. I was rotating in a clinic where all we saw were patients who had survived various forms of trauma. It kind of struck me that almost every single patient, especially the ones that experienced trauma early on in life, carried a diagnosis of ADHD. And those symptoms weren't better explained by anxiety, PTSD, or depression. It did seem that they had this separate issue, this neurodivergence of ADHD. And this book just happened to fall on my reading list around that time, and after reading it, or just even like a third of the way through, it really resonated with me how early life experiences for the patients I was seeing in that clinic had likely affected the way their brain had developed and now is manifesting as ADHD. I'm gonna really simplify it for this video, but basically the system that allows for sustained focus, attention, emotion regulation, it's a very sensitive system in the early brain, in the young brain. And disruptions in the environment, high instability, stress, can certainly have an effect on how that system in the brain develops and cause disruptions. And so, if you have a brain that's already predisposed to ADHD due to genetic factors, and then you also have early life stress, other things causing disruptions, that dopaminergic system, which allows for many of the things that ADHD symptoms account for, doesn't develop in the way that it does for most people. And then you have ADHD in an adult individual, and that's how I kind of conceptualize that. And that can result in increased impulsivity, struggles with time management, time perception, just emotional hypersensitivity, and many, many other challenges that we see in individuals with ADHD. But what's the main thing that my patients actually find valuable from this book? Because I think the science behind it, the explanations are useful in and of themselves. But the main thing that people really benefit from is the way Dr. Maté addresses the shame and the other sort of negative consequences that come from an individual having ADHD, especially at a young age, and the way adults around them respond to their behaviors. Because as with any neurodivergence, a lot of shame can be instilled on a child as they're growing up and they're just reacting and acting differently than their peers. Understandably so, right? Parents get frustrated and your kid's not acting the way you want to. You just, you want some peace. And so it's understandable that more frustration can be taken out. Because as many of my patients with ADHD tell me, there's this real ingrained internal shame that develops very early on in life. This sense of, for whatever reason, they can't keep up with other kids. They're always trying their best, but still getting in trouble. So they're somehow the bad kid. They're deficient, they're funked somehow. Their behavior leads to frustration from parents, disappointment from teachers. And that also kind of compounds this internalized shame and other just feelings of anxiety, inadequacy, and that continues forward and kind of compounds too often into adulthood. And I see this not uncommonly, right? A lot of adults coming in with ADHD, and there's also anxiety at play too. And sometimes it can be very tricky to deciphering, is it primarily anxiety? Is it primarily ADHD? Is it more one than the other? A combination of both potentially. And I'll probably make a future video as to how I distinguish that or try to. But I think oftentimes in ADHD specifically, there is this other component of anxiety, of people constantly feeling anxious that they're about to do something bad, they're about to mess up, because they have so many prior experiences of not meeting people's expectations, their goals, all due to these ADHD symptoms getting in the way of their ability to achieve the kind of success that others set out for them or they set out for themselves. I think the book's emphasis on that internalized shame and explaining it really helps with my patients' own understanding of their shame, of their anxiety, and helps them, one, process that, acknowledge it, and view their past, view their experiences with a little bit more compassion. Anytime we can introduce compassion into one's self-perception, that's always useful. I think another strength of the book is helping people reflect on the impact of their early life experiences. Very often I have people tell me that their childhoods were perfect, nothing was wrong with them, everything was a-okay. Oftentimes in reality, when they actually look back at those experiences, they can see moments of stress, right? A lot of dis-ease, a lot of angst in childhood for whatever reasons. And especially people with ADHD, I think that they can sometimes overlook that very quickly and then back on reflection, kind of appreciate it more to the degree that it had an impact on them. And again, that realization in and of itself doesn't help with anything directly, but it does kind of help fortify that self-compassion. Of course, that then leads to the child-parent dynamic that Dr. Maté talks a lot about. And he tries really hard, I think, to make it non-blaming, and even discussing his own experience of parenting and having a child with ADHD, and even reflecting on maybe some of the ways he responded to that child and maybe affected them inadvertently, doing his best but inadvertently, and perhaps that had an effect on his child's ADHD. And I don't think his goal is to shame parents or parenting styles or anything like that, or even offer that much advice, but it's more to shed light on the sensitivity with which kids absorb their environment, right? They're much more attuned to things, to stress in the household, to tension, to being reprimanded, maybe when it's out of proportion to what they did. And they're much more attuned to that and sensitive to that than I think many adults appreciate. And to what degree that actually influences people's ADHD symptoms later on or not, I think is still very debatable, but certainly it has some effect. The main reason I like this book is it emphasizes self-understanding over quick fixes, because I think in today's society on social media, there's all these hacks, ways of dealing with this and that are easy, simple, but oftentimes that's not how life works. Instead, it's about developing insight, compassion, and acceptance. And also, he doesn't emphasize that everybody with ADHD, the automatic default should always be to going to medications and stimulants. He talks about his experience with that, some of his patients' experiences with that, but certainly there are other methods, mindfulness, therapy, regular exercise, structuring your life and environment in a way that's conducive to your ADHD and doesn't work against it. Definitely videos on that to come. So what's the main quarrel I have with this book? I think it's that he leans too heavily on early life environment towards affecting whether someone has ADHD or not, or to what degree it's experienced. Because certainly we know that it's a very genetic condition as well. Though he does acknowledge that in the book very briefly, I think it is sort of underplayed. I think sometimes that can lead people feeling too blameful of their early life experiences for their current symptoms. My own personal take on why ADHD even exists and what it is I think that it is a neurodivergence that serves a purpose. I can imagine that, throughout history, throughout evolution, If there was a lot of chaos early on in life, it meant that you were living in a very unpredictable, very chaotic situation. And if you had the genetics for ADHD, or what we call ADHD, today, you would then have these traits of being very impatient, very impulsive, being very, very focused on things that are immediately pressing, right? And struggling with planning further out. And that might have been very useful in that sort of chaotic environment. You know, there's whatever is going on, whether it's floods or something, war among tribes or something, you know, thousands of years ago. I can see that people with these strong ADHD traits would then probably fare better than other people. And so it had an advantage, especially if you were exposed to a lot of stress early on in life. And then once things stabilized and the environment calmed down, those traits would kind of go down, would be expressed less, and would be a better survival advantage not to have so many of those ADHD traits. That's kind of my theory as to ADHD. Basically, you have the genetics for it, the environment then determines how strongly those traits are expressed, and that in the past had a survival advantage. I think in today's world, certainly this neurodivergence does give a lot of people some advantage, right? I can think of a lot of CEOs, a lot of very successful, creative people who, you know, I believe have ADHD or have come out saying that they have ADHD. Their ability to hyper-focus, to be very passionate about things that are very tangible to them, very immediate in their life, being very creative, being able to connect dots that other people can't connect. These are all strong advantages. And certainly if you're sitting in the classroom, spending all day, you know, working on flow sheets or whatever, that's going to be a huge disadvantage to you, and it's going to feel very tough. But if you're doing something creative, something you're passionate about, then having ADHD could be a huge bonus. And of course, you know, everybody experiences it differently, and it's different for every individual. So if you are living with ADHD, suspect you have a family member that has it, I think this is a solid book. I think it approaches the topic with a lot of compassion, understanding, and on top of that, you know, first and foremost, the book has to be entertaining, has to tell a good story. And he certainly does that, goes through a lot of case examples, his own story, his own kid's story. And I think that makes it very engaging and very readable as well. All right, so that's my take on Scattered Minds, my first take on this channel on ADHD. I'll definitely make more videos on it. So I hope you found today's video useful. Definitely like and subscribe if you did. Check out my future videos, and I hope to see everyone next week. Thanks.